This is an education video to instruct our staff on the proper technique for donning and doffing enhanced droplet isolation technique.
Located either on the doors or on your PPE cabinets, you will find donning and doffing instructions that will be there all the time.
It's important before you start going into the room that you have all proper equipment set up outside of the patient's door. So that's going to consist of your gowns, your gloves, and your shield, and as well as your N95 mask if it's applicable. So to set the room up, you have to ensure that you have 2 cardboard boxes with a red garbage bag down in each one. So you'll actually have a garbage can on the outside of your door. Then of course you're going to have a garbage can on the inside of the patient's door. So the one on the inside is for trash, and the one on the outside is for doffing of all of your isolation once the door is shut.
This is going to be enhanced droplet precautions. Everyone should apply their PPE before entering the room. You will either wash your hands or use your Purell. She will apply an isolation gown.
You have to ensure that your fingers are through the hole.
Next, she will apply gloves. A surgical mask, as long as she is not doing an aerosol procedure, then an N95 would be required to be worn.
An aerosol consists of ventilators, airborne isolation, any aerosol procedures like handheld nebulizers, and BiPAP. The blue side on the outside.
And she will also next apply a full face shield. Then Tanya could enter the room and she would be appropriately dressed. This will be the doffing of enhanced droplet precautions. Once she exits the room, she will take off the gloves. Next, she will take off the face shield, which will be cleaned at a later time. She will remove the gown by breaking it from the back of the neck, rolling it into itself. Lastly, she will remove her mask. She will then use Purell or wash her hands. Don a clean pair of gloves. Then she will properly clean the reusable mask with hospital-approved disinfecting wipes, starting with the inside, then the outside. Hang it to dry. We have been using IV poles. Then she will remove those gloves, use Purell, and then proceed to wash her hands with soap and water. So handing off a specimen from like an A-line draw of a blood gas, Tanya would be in the patient's room. She would come out, her specimen would be in a biohazard bag inside the room, and then respiratory would be standing outside the room with another biohazard bag for handoff to take it to the lab. Respiratory handing off an ABG, which they collected, to the nurse. Respiratory will have it already in one biohazard bag. It will be placed in another biohazard bag, which the nurse is holding by the outside of the biohazard bag. Her fingers do not need to be down in the bag. Then it will be sent to lab for analyzing. Handing off lab specimens from any patient, the nurse would come out of the room with them in a biohazard bag. She would then place it in another biohazard bag of the lab tech. She would then close it and proceed to the lab. Jenny will perform the donning of airborne isolation protection. This will be for patients with aerosol procedures such as continuous BiPAP, intubation, breathing treatments, or suctioning. First, she will put on a gown. Next, she will apply an N95 respirator. If you are doing one of the aerosol procedures, you will discard this and it will not be reused. If you are just going in to check on the patient, give a medication, something that's not requiring an aerosol procedure, you can place this N95 in a brown paper bag after use. Next, she will apply a full face shield. Gloves. And Jenny also has on shoe covers.
Those are not required though.
Those are not required for airborne. Then she will enter the room. Doffing PPE example number 2. Jenny will show you a second example from what Tanya demonstrated earlier. Jenny is wearing shoe covers. However, she will start from the most dirty and go to the least. Her shoe covers would be where she would start. Those are not required, but you can wear them. Jenny is also going to show you how to take your gown off and not take your gloves off, but take them off together. She's going to roll the gown in and bring the gloves off at the same time. She touched the inside of the gown.
You don't want to break.
Next, she will remove her shield.
And if you want to, you can use hand sanitizer in between that step. Some people do. So then I will remove my shield.
Which she will clean at a later
So
time.
I'll lay it on the floor until it gets clean. Then
She will remove her N95. If she was not performing an aerosol procedure, she was only giving the patient medications, she can place this mask in a brown paper bag with the patient's name and room number along with her name, and this mask can be reused for up to 3 consecutive days if she had and she could also place a surgical mask over it if she desired.
Yes, and I do my hand hygiene.
She would perform hand hygiene, and she used Purell, and then she could go use soap and water.
Yes.
I just wanted to clarify about the enhanced droplet, the use of PPE, and the enhanced droplet plus airborne precautions. In enhanced droplet precautions, the only PPE required is gown, gloves, and a surgical mask like I have on, and a full face shield or the hood with a face shield on it that's reusable, wipeable, cleanable. That is all that's required going in enhanced droplet, unless you're going to be doing an aerosolized procedure, and then at that point it would require the use of an N95. And if you're not in direct front of the patient getting aerosolization, that N95 can be reused for up to 3 days by putting your name on it and putting it in a paper bag, writing your name on the bag, and storing it outside of that patient's room on the cart. You can reuse it for that same patient. Okay, now droplet, enhanced droplet with airborne precautions is when the patient's placed in negative pressure. The reason they're placed in negative pressure is because they're having a lot of aerosolization procedures. They're either on continuous BiPAP, CPAP, getting numerous breathing treatments, or in the event they would have to rapidly be intubated. So at this point, they're in both types of isolation. So what is required going in, if it says enhanced droplet on the door, in addition to airborne precautions, is gown, gloves, an N95 mask, and a full face shield. With your N95 mask, you can place a surgical mask over top of it to preserve your N95 mask. Then when you come out of the room, remove your surgical mask, throw it away, and your N95, you can store it with your name on it in a paper bag to be reused on that same patient. Moving forward, as a safety precaution for hospital personnel and patients we already have in the hospital, because COVID can present with many different signs and symptoms. Moving forward, any patient that comes in with respiratory symptoms, we're going to go ahead here at Logan Regional Medical Center and place them in enhanced droplet precautions and treat them as if though they were a suspect patient for everyone's safety.
Okay, everyone, I'm Jenny. I'm going to show you how to use a PAPR, which is a personal air purifying respirator. So we have 4 of these in the hospital. We have 2 chemical respirators. So we have 4 there in these royal blue bags. And Dawn, where are they kept at?
2 of the royal blue bags, the PAPRs, are kept in ICU, and 2 are kept in the emergency department.
Most of the time, your physicians will want to use these when they are intubating a patient or spending a long duration doing procedures up and close to the patient. So what this looks like, and there's several different hoods that you can wear, and these are reusable. So this is one, and they pop right off. This is one that covers the shoulders, and you can see what that looks like. And here's one that just fits over the face. And I think I will demonstrate using this one. Crystal, you here to hold that one? And these do have to be charged. They come with a charger. So, here's the generator for the PAPR. You want to put that on the side so you can still press the button to turn it on. We'll make sure that'll fit up over there.
And everything on the paper is reusable, wipeable, and cleanable. You clean it with hospital-approved disinfectant and allow it to air dry.
Now, Crystal might have to come over here and help me put this on, but it should fit right over my hair, head, and everything. You can see how that comes out the back. And then when you're ready to turn it on, I'll make sure I got a good seal. And it blows air through the back, up and down out the holes right here. So you get a, positive
pressure. And you do not inhale anything upwards. It's pushing the airflow downwards, keeping you safe while you're wearing it.
You're not required to wear a mask underneath these. If it makes you feel better, you can wear a surgical mask, but it's still not required, but you know, if it makes you feel better.
That is just like an N95, and where it has the positive air pushing through, that's what keeps you safe from inhaling or ingesting any particles.
So after you doff your equipment, just like if you had a shield on, you take this part off. And you know, I would take this part off, and then this all can be cleaned with bleach or the approved cleaner. And also the inside of this and the outside of this can be cleaned, and it's not contaminated if it's just stained with makeup, because you know a lot of us wear makeup and it rubs off, but that doesn't mean it's contaminated. If it's contaminated, that means with blood,
Body fluids,
Body
secretions from the patient.
yes. So that's how you use a PAPR.
Thank you for watching, and if you have any further questions, you can contact us. Thank you.